I'd like to talk to you about Crohn's disease today. Crohn's disease is a disease process that affects your GI tract. It can affect anywhere from your mouth down to your anus, and it targets the lining of the intestine. Because Crohn's can affect any part of the GI tract, it can result in very different symptoms, including crampy abdominal pain, diarrhea, bleeding, and in the lower part of the GI tract, it can cause drainage, pain, and infection. Crohn's disease can appear at any age, but it most commonly appears between the ages of 15 and 35. It affects men and women equally, and a family history can sometimes increase your risk of developing Crohn's disease. While the exact cause of Crohn's disease isn't known, we know that it affects the immune system. Current research focuses on abnormalities in the immune system as well as bacterial infections as possible causes of Crohn's disease. It's important, though, to understand that Crohn's is not contagious. When you visit your doctor to talk about your symptoms, your doctor will ask you questions about your personal health history and also your family history. Your doctor will then examine you and decide if you need further tests. Some of those tests might include looking at the upper and lower part of the intestine with a camera. They might include blood work and X-ray testing. This will help your doctor to determine if you have Crohn's disease and also what the extent is. The treatment of Crohn's disease often starts with medicines, and your doctor will help determine which medicines are best for the type of Crohn's disease that you have. Surgery is used when Crohn's becomes complicated and the medicines are no longer working to treat your Crohn's disease. Abdominal surgery for Crohn's disease can include removing a piece of the small or large intestine and also dealing with infections in the abdominal cavity. Anal and rectal surgery for Crohn's disease address problems like an abscess, which is similar to a boil, other infections, and other problems that arise in the anal and rectal area because of the Crohn's disease. While surgery may improve the symptoms of Crohn's disease, it's important to remember that Crohn's disease is not curable. That means that even after surgery, you have to continue under the care of your doctor, and you might need to take new or different medications. Following your doctor's instructions is so important, but you can have an influence on your Crohn's disease as well. And that would be by living a healthy lifestyle and avoiding bad habits such as smoking. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.